Everyone, my name is Janelle Solomon and I'm going to share a presentation with you today about medical thermography and answer some questions that you might have about what exactly it is and why you should care, what benefits it has for your health. So I'm a certified thermographic technician and a 200-hour registered yoga teacher, a member of the Professional Academy of Clinical Thermology, or PACT, and a member of Breast Thermography International as well. So we'll jump right in here with some statistics. 1 in 8 women will develop breast cancer, 280,000 new cases of invasive breast cancer diagnosed annually, and over 40,000 deaths occur annually from breast cancer for both men and women. It's not just an issue for women. 80% of breast cancer patients have no family history, which is a huge misconception. A lot of people think that it's all about the family history. By 2030, it's estimated there will be over 400,000 new cases of breast cancer annually, and 1 in 833 men are diagnosed with breast cancer as well. So a little bit about the history. It started way back in the day. It was a little bit different back then. 460 BC, Hippocrates used mud and clay to look for areas that dried faster so that he could tell where there was heat in the body. So if over a certain organ, perhaps he was looking at the liver, and the liver, that area dried quicker, he would know that there could potentially be something going on with the liver. So obviously it's come a long way since then. Infrared cameras were introduced and Barnes thermography was patented in 1960. Some of the really important things that happened are listed here. In 1965, Gershon Cohen introduced infrared imaging in the US, and the US Department of Health, Education, and Wellness labeled thermography beyond experimental in 1972. Then in 1982, thermal imaging devices were cleared by the FDA as adjunctive screening for the following: breast cancer screening, thyroid pathology, cerebrovascular screening, peripheral neuropathy or vascular disorders, and neuromuscular conditions. So we are looking for many different things when we do a thermography screening. So we talk about preventing, detecting cancer. What exactly is cancer? So it's the uncontrolled proliferation of cells. So everyone has cancer cells in their body, and it's normal. However, once the cancer cell attaches to a blood supply and starts to be fed by that blood supply, then the cells start to grow and form a tumor. And this process can be very quick. Cancer doubles on average every 90 days. It can also take a lot longer. This is a picture of what I just described, angiogenesis. So you can see the clump of cancer cells attaches to blood vessels and then eventually creates a larger clump of cells known as a tumor. And this process, again, can take years and years, or it can develop quite rapidly depending on the cancer. Thermography is so amazing because we are detecting the thermal the thermal activity that is present in that process. So this just shows you 2 years, you would have, 2 cells would develop into 256 cells. And at that point, thermography could pick that up because that process that I just showed you on the previous slide, angiogenesis, that actually creates heat. So as a blood supply is feeding a clump of cells, that process creates heat, and we are picking up on that heat. If you look down here, after 7 years, you have a lot of cells, a lot of cancer cells. That's the point where a mammogram might see those cells. So a little bit different there. And here's some other screening methods that you have definitely heard of. So we've got the mammogram, which is an X-ray photograph of the breast with X-rays. Ultrasound is a high frequency sound wave to produce detailed images. MRIs, magnetic resonance imaging, to detect cancer and other abnormalities. And then here is thermography down at the bottom, high resolution infrared photograph of heat patterns in the body. A little bit about mammograms. So in 2012, Harvard School of Public Health discovered that routine mammograms may result in significant overdiagnosis of invasive breast cancer. So this study basically suggested that mammograms may in fact lead to a significant amount of overdiagnosis of disease that would otherwise have proven harmless. There's a study of women in Norway. The researchers estimate that between 15% and 25% of breast cancer cases are overdiagnosed. Reach out to me if you would like that study as well. And then here's some more information on mammograms. So they do emit ionizing radiation. 80% of biopsies that are performed as a result of mammograms are negative. And then 20% of the negatives are false. Mammogram guidelines are being challenged at this time, even within this country. We are questioning, is it too much radiation for women under 40? Women in their childbearing years, as we know, women are having children later and later these days. And so, you know, we are questioning finally now in this country, in addition to other countries, what age is safe. Okay, so thermography, as I mentioned before, we're doing the thyroid screening, breast screening, cerebrovascular screening, hormone imbalances, spinal analysis, vein thrombosis, nerve pathology. So we're checking for all these things. The infrared camera and software allow our thermologists to analyze your temperatures and vascular patterns throughout the surface of your body. And then after you establish that baseline, that initial baseline study, you then have a comparative study. And then we'll be able to see if if you have any changes in temperature throughout your body that could indicate imbalances, including toxicity, hormone imbalances, cancer, or other disease. And here's some more information on thermography. It is detecting physiology instead of anatomy. So the anatomical screenings I mentioned before, the mammogram, MRI, and ultrasound, those are anatomical screenings looking for physical lumps or bumps. And this thermography is a physiological screening, looking for heat. So we're detecting cells not dense enough to show on X-ray. So it's a completely different test here. There's no compression, no radiation, and it is safe at any age. And I'll go through a few case studies with you guys so that you can see what thermography looks like. So this is a fairly normal breast screening. So the breasts are nice and blue, which means that they are cool. One of them is not hot, the other one being cold, meaning we are looking for symmetry with thermography, symmetry in terms of temperatures being relatively similar in each area on either side of the breast. Now here's an abnormal image of the breast. You can see in this, in the chest, in the upper right side, she has a lot of vascularity going on that's not there on the other side. The temperature and the delta T, or the change between the two sides, is probably significant there. Here's another abnormal image in the grayscale. You can tell that inside of the red circles there, there's activity going on the left side of the screen here, and the right side, it's very clear in that same region. This is an image we do from a different angle underneath the breast. Again, it's that same woman who had the thermal activity going on in the upper left breast there. Inflammatory breast cancer is quite rapid a lot of times, and it's not detected by mammography. It can very quickly increase in heat. Like this woman, this was every 3 months she did a screening, and she was monitoring her cancer, and it very rapidly progressed. So please stay up to date with your thermography screenings when the interpreting doctors are recommending for you to do so. Little disclaimer, there are some graphic images. Here's one of them. patient refused chemo and surgery and wanted to do a natural treatment, which she did. And she's still with us. So thankfully, it worked. There is a time and place for conventional medicine for all my holistic ladies and gentlemen, but it's always up to the patient and what you feel is right for your body. And this woman was monitoring her cancer progress and her natural treatment with thermography. So monitoring improvement is my favorite part of the job. The woman on, this is the same woman, but in the top images here, she had a lot of thermal activity going on. And she went away, did some lifestyle changes that we recommended and got her follow-up screening, and she had improved so incredibly much. I was so proud of her. And that's my favorite part of the job, is just seeing how much people are improving. So we want to continue to monitor changes as recommended. So 6 month, 3 months, 6 month, or 1 year is typically the length of time that the interpreting doctors will recommend. Just depends on the patient and it depends on the results. So we do more than just breast screenings. We do full body thermography, checking for all the things that I mentioned earlier. Here is a thyroid screening of someone who improved their lymphatic congestion and heat over the thyroid. On the left there, you had a lot of inflammation in the mouth leaking down into the neck. And on the right, it has significantly decreased. Here is the grayscale where you can clearly see oral inflammation and lymphatic drainage from the mouth leaking down into the neck, the chest, and the breast. And I like to say here that the health of the mouth is directly correlated to the health of your chest, of your heart, your breast, really anything that it's in direct line of gravity with. It's got to pass through. So if you've got bacteria and infection in your mouth that you don't know about, gravity is going to take that right on down, and it's not going to be a great thing for your health, as you can imagine. This woman improved their oral inflammation significantly and the thyroid as well. She probably did some oil pulling and went to see her biological dentist perhaps. So monitoring improvement, again, this person probably got a chiropractic adjustment to relieve their neck pain. And this gentleman here is a great example of why we do the cerebrovascular screening. It's so incredibly important. So we have carotid arteries that feed up into the supraorbital veins on your forehead. And if your carotid arteries get blocked in any way, you can have a stroke, basically, sometime down the line. So as you can see, this gentleman has black on the forehead there. That is not normal. That means there's no oxygen getting to his brain. He did have a stroke 2 weeks later after this screening was done. Please get your full body scans, get your upper body scans, make sure we're looking at your whole body and not one section of it. Improvement in spine and neck after a chiropractic adjustment. You can even tell he's standing straighter. This is abdominal inflammation with an overlay here. You can just kind of see how they use it in different countries. Brazil uses a system like this, where you can see, the anatomy along with the physiology. This is a woman who had melanoma and never knew it. There was nothing to the naked eye on her back, and she got a full body screening, and we were able to catch that. We also take images of your arms and hands if you do a full body screening, just to make sure that your fingers and toes are not black, which means poor circulation, and also checking for inflammation in your joints and your muscles in those appendages. Here, this gentleman has a lot of heat in that right foot, could have something off with their gait, perhaps. Looks like maybe a sprain in the toe on that left foot there. And so here's a little bit about the process, just so you guys know. What you'll do is you'll fill out your new patient intake forms. It's all online. Be as detailed as possible with that process so that the interpreting doctors can review your information. Once they receive your images, they can put all your information together and create your report for you. And the patient protocols are extremely important as well. You want to read those over and make sure you follow instructions. There is an acclimation process when you're in the room about to get your screening. You'll acclimate for 10 minutes in a nice cool room, 68 to 72 degrees. Then the imaging takes place. It takes about 10 minutes on average. The interpretation is done by the interpreting doctors, and they will send you the results in 1 to 2 weeks via email. Then you'll schedule a consult with your doctor to go over your results, and you get a second phone report review with me, your technician, and I'll make sure I answer all of your questions and we can discuss recommendations as well. This shows you what the types of scans and the cost of those scans we offer. Full body scan is $549, health screening is $349, and the breast is $249. All of the reports come in both the rainbow palette and the grayscale. Very detailed reporting, and again, you do get that review as well. It's a 30-minute phone call. There are ways to save. Please ask me for more information on ways to save. We have an amazing patient referral program, and I'd love to tell you more about that. And there's also a prepayment plan. You can use your HSA and FSA accounts if you have one. And then the website, United Breast Cancer Foundation, is incredible. If you apply, they will give you money for your screening if accepted. So we want to move toward optimal health and away from disease. And thermography is an amazing way to help you do that. I offer a discount to patients and people that take the time to watch the presentation. So if you do that and that's how you found out about us, let me know and I'd be happy to apply that discount for you. Call me or email me for the discount code. And love your health, invest in yourself. Hope you guys enjoyed the presentation, and I look forward to hearing from you very soon.